Hi, my name is Kiriana Lynch, and my empirical research question was, are chia seeds related to a decrease in systolic blood pressure in adults with type 2 diabetes? I chose this research topic because it showed a direct correlation to nutrition and how the things we include in our diet may or may not have a positive or negative effect on our health. My non-reliable resource was labeled Chia Seeds in Type 2 Diabetes, a Nutritious Combination by Kilstein. This was a non-reliable source because it talked about how the omega-3 fatty acids had a direct correlation to a decrease in blood pressure and the risk of cardiovascular disease. However, there was no research evident in this article, and there was no proof or statistics backing this up. My reliable source, however, was labeled Chia Seeds Supplementation to the Diet of Adults with Type 2 Diabetes Improves Systolic Blood Pressure, a randomized controlled trial by Aloysius. This was a reliable source because it was a controlled experiment and it showed the control group, the people that it used. It had an introduction, method, subjects, conclusion, and results, and it was peer reviewed by others, and it shared its knowledge with others in the scientific profession. It also had proof in data relating from the results of the trial. This was hypothesized, tested. It talked about the possible errors that may have been in the trial and that may have occurred throughout the trial, and it is also recreatable, so others are able to do this trial as well and see if there is a direct correlation between chia seeds and a decrease in blood pressure in patients with type 2 diabetes. This trial was taking place on adults with type 2 diabetes aged 21 through 65 who had diabetes for at least a year or more. Their blood sugar was 7% or more, and they had stable kidney function and stable medications that they were taking for over 3 months. This was a 12-week trial in which they had two groups, the controlled group and the experimental group. The control group was given no placebo food, and then the experimental group was giving 40 grams of chia seeds per day for the 12-week span. The experimental group was able to space these 40 grams of chia seeds out throughout the day, throughout their meals and snacks, or they could eat it all at once, as long as they were reaching that 40 grams of chia seeds per day. The results of this trial showed that there was a direct correlation between chia seeds and the decrease in blood pressure. The blood work was taken before as a baseline and then after the 12 weeks, and it showed in the experimental group that it averaged around 132 millimeters of mercury for the systolic blood pressure, and at the end of the experiment, the experimental group averaged around 119 milligrams of mercury for systolic blood pressure, showing an average of 10% decrease. Versus the control group, there was not a significant decrease between the baseline and the after results of the blood work. The reason why I chose this subject and think it's great to be studied is because it can expand the knowledge of how nutrition can affect your health, and it can maintain and help control type 2 diabetes for patients who don't have necessarily access to a bunch of medications and healthcare, and easier ways that they can do this at home, specifically hypertension with adults in type 2 diabetes. Thank you.